I was dealing with a patient recently with shoulder pain, and in the treatment we used heat, castor oil, topical agents, and a lot of movement and massage after the acupuncture treatment. But if you can't get acupuncture, do some stretches that will help move stuff around in areas of pain. Today we're going to talk specifically about shoulder pain on one side around this area. It makes it difficult for the patient to move their arm back, put on clothes, or take off jackets and things like that. This motion is a very big motion. We don't really think about how much this can impede our breathing, every little thing that we do in life. So the key with areas of pain for me is movement. Getting movement in there, comfortable movement. That usually starts with using a topical, a hot pack, an ointment, something to rub in the joint to help before you start moving it around. I've supplied my patient with 10-minute exercises to do 3 times a day during this initial acute phase. There's no known injury. She just sort of woke up this way. So what I think is that there's just like stagnation of energy, buildup of chi, things aren't moving, it's been cold, we're all like this right now. So that's getting up into the neck, into the jaw and head, and sometimes going down the arms. So let's just go through these stretching protocols and I'll show you what it is that we're having this particular patient do. This might help you in your shoulder pain as well. First, I would want them to heat the area with a hot pack. We have microwavable, rice-filled hot packs, and we also have some that are filled with cherry pits. If you're not local, then make your own or buy your own. The first stretch that we're gonna do, we're really gonna work on like the superficial fascial layer and doing some easy stretches that aren't gonna hurt and are just gonna help get movement in there and get some lubrication and break up adhesions. Instead of things moving like that, we want things to glide and move smoothly. So the first one on the list is the pendulum stretch, and this is a nice, easy way to warm up into these stretches. So you're gonna wanna support yourself. With the unaffected arm, I'm gonna support myself. And I'm just gonna lean forward and let that affected arm dangle and swing. And we're just gonna let it go. A lot of times with pain, we're holding on to it and not realizing that just allowing it to let go can sometimes be helpful. And then you're gonna start gradually swinging the arm in circles. Clockwise, counterclockwise, and we're just sort of increasing the size of the circles. When we're letting stuff move, we're increasing the lubrication in the area. And then I'm gonna switch directions into the other side. I'm not experiencing any shoulder pain right now, but if you are, this is a nice non-scary thing to do. When you're in pain, it's scary to do movement because you think you're gonna hurt yourself. You can do 1 minute in each direction. And this is something you can do at your desk, in a break room, in a bathroom, in a public area, because we should be stretching in public more. The crossbody stretch is going to take about 2 minutes total. Use the unaffected arm to gently pull the affected arm across the body, keeping the shoulder relaxed. So if this is the affected arm, we're going to make sure that we're not holding things tight, and we're going to make sure that this shoulder is relaxed and that we're pulling the affected arm across the body. And I feel that in my neck and ears and down the front of my arm a little bit right here. And if you are experiencing pain in that shoulder right now, You might just want to hold this position and breathe. Hold this for 20 to 30 seconds at a time. And make sure that you're getting those nice deep cleansing breaths in there too. Let it rest. Maybe some shoulder rolls. And then repeat. You can increase the stretch if you can go further, but we're really not trying to move mountains here. We're just trying to get attention to the area, movement in the area. When we're hurting, we tend to clam up and hold everything still, and we really need to get that circulation in there, because circulation is blood, it's interstitial fluid, it's all this stuff that keeps us lubricated. All right, I'm gonna move on to the doorway stretch. You've all seen this. This is one that you're gonna hold for, it's gonna be 2 minutes total, and you're gonna hold it for 20 to 30 seconds at a time. And this, you're gonna be doing arms in 90-degree angles, stepping into the doorway and letting the whole front of the body stretch. Not necessarily something you wanna do too late at night, because heart openers and things that are stretching the front of our chest might be a little bit too invigorating. So we're gonna go to the door. You'll see this one. Head neutral, jaw neutral. Just letting that stretch happen across the front of the chest. What kind of face are you making when you're doing these stretches? Are you allowing the stretch to happen in the area of concern? Sometimes we're stretching one area and we're holding on to another area, and it doesn't really benefit us that much to do that. Make sure that the area that you're working on is actually the area that you're stretching. This internal rotation stretch with a towel is a nice one, and this might be a little bit owie, but what you're gonna use is a towel, and that's the only prop. You're gonna raise the affected arm up with the towel in the hand, and bend the elbow, and take the affected hand and grab the towel in the back. And you're gonna gently hold the affected shoulder in place. Prop it on your head if you want to. We're not hiking up the shoulder or clenching our jaw, but just using some gentle pressure, pulling down. And don't forget to breathe. That's another one that you're going to be repeating 2 to 3 times after a 20 to 30 second hold. I like doing that one on both sides. It might be difficult if this shoulder is hurt to grab that towel from the back, but you can try. If it's really bothersome, then just focusing on that one side can be fine. Doing those shoulder stretches into the doorway will get both of them. And then the last one for this 10-minute series is the posterior shoulder stretch. This is similar to the across the body shoulder stretch, but it's a posterior shoulder stretch. This one's gonna be more up at the top of the chest, so we're getting a slightly different area in this rotation. It's gonna be further up, and then you're gonna be pulling that towards you. Very similar to the across the body stretch. We're not pulling the arm like we were with the cross body stretch. We're more pushing the arm into the chest. And this is gonna get a slightly different area up in here. So those are just a couple of stretches that should take about 10 minutes every day. Do them a couple of times during the day just to help keep that movement in there during this acute phase. And then if this becomes a chronic condition, we could talk about doing 20 to 30 minute stretches once a day. That will help set up the situation and make this a lot better for you. So there we go. Thank you.